first say hello, everybody. Thank you for spending this Friday evening with us. I'm sure you have lots of other fun things you can do. But we think this is great information, and we want to make sure that everyone's staying safe out there in the coming months. Uh, my name is Katie. My pronouns are she, her. I'm a street medic in DC. Bianca, take it away.
Hi, everyone. My name is Bianca. My pronouns are they, them. I am also a street medic in DC, and I want to let JJ introduce themselves before we jump into housekeeping.
Hi, I'm JJ. They, them pronouns. I am also a street medic in DC, and I will be watching the chat and helping moderate that. So I will be the go-between the chat and talking to our wonderful training friends.
Excellent. So do not be shy with your questions. We are here to answer them. So before we start, I think it's really important to do an acknowledgement that we are doing this good work and we are operating in this space on stolen land. So this space, at least where JJ, Katie, and I are located, is Piscataway and Anacostan land of the native people that lived in this country before us. And so our work is not only to do the good work in spite of having colonize this space, but like to undo some of that harmful history as well. We are deeply indebted to the Boston Street Medics who put together most of these slides. We've used them with permission. They also have an ASL interpreted version of this training, and it is available on YouTube. So if you want to share that information, it's going to be available in a Google Drive that we share with all of you that has these slides and some other resources for you. Katie and I will be the ones doing most of the talking, and JJ will be wonderfully moderating and answering in comments. So if you have questions, we ask that you ask them in all caps, and that way JJ can relay them to us easily. The other thing is this is an anti-oppressive space, so that means absolutely no isms are welcome here. We've all been affected by racism, homophobia, transphobia, ableism, white supremacy, all of that. It's baked into our culture. As your hosts, we're continually working to get those isms out of ourselves, and we are not going to tolerate any trolling or doubling down on those things in this space. But if we say anything that needs addressing, please let us know in the comments so that we can be better as we facilitate this space. I'm going to let Katie say a little bit about accessibility.
So there are a couple of things that Zoom does to help us uh, and offer some accessibility. So one is there's closed captioning. If anyone needs closed captioning, they can go to the bottom of their screen. There should be a little icon that says closed caption. And if you click on that, you should start seeing some words start popping up at the bottom of your screen. If you want those to go away, you click on the little caret next to it, and a little menu will pop up, and you say hide subtitles, and they go away. Now, if you want to be able to see JJ, Bianca, and myself while we are talking, you go up to the top of your screen, you'll see a little black drop down that says view options. If you click on that, you go to side-by-side mode, then you'll see both our presentation and whoever's talking lovely face on the right side of your screen. If you want to just see the person talking, you click over in the right upper corner. There should be either a view that says either speaker view or gallery view, and you can toggle back and forth between the twos. JJ, our moderator, will post a link to the Google folder with tons of handouts in the chat. Some parts of this are very text heavy. We'll try to read as much as possible. Don't stress about taking notes. The handouts will all be there. JJ also has the link to that similar presentation on YouTube done by the Bostic Medics with ASL interpretation. So if you want that or you want to share that with your friends, please go ahead. We are definitely going to try to get a training with ASL interpretation in the future. So if that is something you are interested in, please reach out to us and let us know. Are there any other ways that we can make this more accessible? Again, please let us know. We're always trying to do better and put them in the chat. Now, I've seen 2 all caps questions. I think JJ might have got kicked out of the meeting for a hot minute. And there's a question.
I'm still here. I was just getting
cool.
on my phone as well so that I can type while also screen sharing.
Oh, gotcha.
So the two questions are, one person asks, what are street medics?
So it's a great question because lots and lots of folks out in the street might say, I'm a medic, let me help you. When someone says they're a street medic, that should mean that they've had a specialized training in what it means to help people in conflict work work and protest and do whatever tactics they're thinking about in a safe and meaningful way, or as safe as can be for them. And it means that they are grounded in anti-oppressive doctrine. That doesn't mean everybody who says they're a street medic is a street medic or has gone through that training, but they should be respecting your personal space and boundaries, and they should be constantly checking in with you. And they should be looking out for your best interest and not the cops or counter protesters' best interests. Bianca, anything you think I should add to that?
I feel like that was a really comprehensive answer. It's worth knowing that street medics, while they do, there is sort of a standard training that many people go through. They come from all different backgrounds, some of whom work in the established medical space in their day jobs, and some who do not. We do not find that there is a hierarchy between those forms of training. We're all working together as a team, and our top priority is just to keep people safe when they're doing what they need to do.
Awesome.
And then someone else asks, how's everybody doing tonight?
Woo, woo.
Woo!
Doing good. It's been a long week. I imagine many people feel that, but I'm really excited to be here with y'all. So you're bringing me energy. It's good. And JJ, you can flip to the next slide whenever you want. I don't know if either of you had other things you wanted to add about how you're doing.
Doing great.
I would.
Very good. Okay, so the first thing that we want to go over today is really about super basic things in terms of how to check in with yourself and understand what your baseline is before you go into an action. Because the important thing is you can't take care of anyone else. You can't be a good present activist if you are not okay personally. So we sometimes use the acronym HALT. Are you hungry, angry, lonely, tired? So if you're not feeling good, you're not at 100%, it's a really good idea to check in with yourself and figure out what it is that you might need to get up to 100% before you go out into the streets, because it can be a very emotionally and physically taxing place to be. And we want you to be your healthiest, best self. That also means planning ahead, knowing what your stop point is, because everyone has a point where they need to call it quits, go home, get some rest, and you need to know what yours is. It's okay if it's not the most radical, fighty point. We all have our own circumstances, our own emotional needs, and we just have to be real with ourselves about what those are. It may also be good for you before you go out to an action to think about what tactics from police or counter protesters you might face on that day so that you can be mentally prepared. Sometimes we call this idea cognitive rehearsal. It can be less stressful when you're in stressful situations if you've thought about it ahead of time and have a sense of how you want to be in that moment. The other piece of this is if you've checked in with yourself, you should also have a counterpoint, a buddy who can be your check in person. The buddy system works, y'all. You want someone who's watching your back and who can help you go into and leave a protest safely and just be the person that's looking out for you. Another point is that we want to always spread calm. You're going to hear this a couple of times throughout the presentation, but the number one weapon of the police is fear. So beware of people spreading unfounded rumors. And if people are starting to run, you want to calmly and assertively say, please walk, because calm people make good decisions. Panicked people make very bad decisions. So you want to do everything possible to keep yourself feeling calm and to keep those around you feeling calm. And the best way to do that is to be at your body's baseline. So that means enough sleep, enough water, ideally no drugs or alcohol the day before so that you are feeling tip top, and drinking lots of water while you are at the action so that you are not intentionally dehydrating yourself. Um, Also, please bring any meds that you might need, because if you have been prescribed an EpiPen or an inhaler, if you're in a stressful situation, you do not want to be without those. Likewise, if you are in a situation where you might be arrested and you have medication that you cannot go without, you want to have those on your person. Legally, the police are supposed to give you access to those medications. You can't always guarantee that the rule of law and the practice of law are going to be equal, but better to be prepared and have those options available to you than to have left them at home in the first place. And then always be on the lookout for us, the street medics. We will generally be wearing clothes with bright red X's in duct tape on them so that we are easy to identify. And you can always shout medic really loud if you are concerned about yourself or someone else and need some attention quickly. Go ahead and flip to the next slide, I think. So this is a nice packing list for you. Don't freak out if you can't put all of these things in your bag. This is a suggestion list, and it's a best case scenario. But there are folks like us and Care Bears that will also have supplies like these around. But in an ideal world, you'll come with all of this stuff. So I'm just going to sort of read down the list. Water, really crucial. Your buddy, like we talked about. Clothes for the weather. It is getting cold out here, and especially if your action is at night, it is going to be colder than you think. A hat, sunscreen, and bug spray. Oil free if possible. We're going to be talking a little bit about chemical weapons and why oil is not your friend if you encounter them. A bandana or a mask. Goggles with a silicone gasket if you're concerned about being sprayed with pepper spray. Rescue meds, like I said. Extras of whatever it is you need if you're going to a multi-day or remote action. So extra socks if you think your shoes are going to get wet, extra meds, extra water. Keeping the NLG number on your body. So that's the National Lawyers Guild, and they are the folks that you want to contact if you've been arrested so that they can coordinate to let folks know where you are and work on getting you released. And then you might want some stress relief items, cash, an ATM card or ID as appropriate. We can talk more about whether that's a good thing to carry for your individual action, but we're not going to go too deep into the nitty gritty right now. Then if you want to be super helpful so you can share with other people, you might want to bring snacks, more water, extras of the sunscreen, bug spray. Hand warmers are a hot commodity right now. We'll talk a little bit about how to do eye flushes if you are pepper sprayed. So an eye flush water bottle, which is like a squeezy bottle, and gloves. Cough drops, handouts, menstrual pads, hand sanitizer. We are in a pandemic. Hairpins and ties, safety pins, and more stress relief things or basic first aid items that you specifically know how to use. And Katie or JJ, do you have anything that you want to add to that? Beautiful. Okay.
One tiny thing. If you're bringing your meds, you need to bring them in the original container for the pills. Otherwise, the cops aren't even gonna like pretend to be on board with it. So like, it needs to clearly show what it is and who prescribed it and when it was prescribed. Which like when you get it from like CVS or Walgreens or Harris Teeter, it should have that on it. That was it.
Very good point. So one of the things that street medics hold as sort of their core ethos is this idea of radical consent. So consent is the difference between aid and assault, and this is something that we talk about a lot in medicing communities. So if I walk up to somebody and I squirt water in their eye, that's assault. But if I offer them an eye wash after they've been pepper sprayed and they say, yes, please help me, that's assistance. So we need to operate in this idea that everyone around you has experienced some kind of assault on their bodily autonomy, whether that's from the police, from a violent society, from systemic racism. There's just a lot of general shit in the world today. And we're trying to build a better world. So we're trying not to add to harm, but to slowly undo it. So that means asking before we give assistance. That applies both to the spoken word, so before we ask really personal questions or give someone directions, but also before we touch them or render physical aid. So always ask somebody before you touch their body or before you touch their things. And especially if there are folks who use assistive devices like a wheelchair or a cane, you must absolutely ask before you start touching those materials. Um, yeah, no, not cool. Please don't do that. um, you're going to need to be overly cautious about asking for consent. So that means asking before every different type of assistance or touch. Just because somebody's willing for you to give them a band-aid doesn't mean they want you to put it on. Just because someone is leaning on you for assistance as you walk doesn't mean that they want a hug from you. Always assume that you don't have consent until you've made it someone has made it clear that you do. So that's the idea behind affirmative consent. We need affirmative statements from our friends and compatriots, not assumed consent. And remember that that consent can always be withdrawn at any time and for any reason. No one's required to accept our help, even if we think they need it, and everybody is the boss of their own body. You would want to be treated that way, and so you should treat other people that way. And this is true not just in protest spaces, but everywhere in the world. I do a lot of consent education outside of protest spaces, and I think it's good advice just to carry with you forever and ever. And it's especially important right now with physical interactions during COVID, where our risk is even higher for transmission of a potentially deadly disease. Hooray! Okay, I'm going to pause for a second if there are any questions.
Nothing has come up in the chat so far.
Cool. Katie, I think you're on deck, or you're up.
Awesome. And if anyone wants to wait for one of those pauses and unmute and ask a question, they should feel free to do so. Okay, so we've been talking a lot about having a buddy, but how do you find a person that's compatible with the work you want to do? So medics use Pearly. This is a tool that we use to make sure that they and their buddy are a good match and that you can both support each other for whatever you're setting out to do. So Pearly stands for first, physical vulnerabilities. So this means, are you up for long walks? Do you have difficulty in loud situations? It also might include your COVID-19 risk profile and how careful you need to be to avoid infection. And also think about who you're going home to and who you might be bringing COVID home to yourself in your life. E is emotional vulnerabilities. And you might want to include anything that might be especially or surprisingly harmful emotionally to you. For me, example, I no longer really appreciate helicopters flying overhead after some of the actions in the spring and summer. So that would be something I would share with my medic buddy. Arrestability. Now, you want to think about your own personal arrestability. We often use a green, yellow, red system. So green is, I have no desire to be arrested today. Always remembering that there is no action that is entirely a risk of arrest free. But you're running very, very clean and you have no desire to be arrested. Yellow is, I would prefer not to be arrested, but it is not the end of the world if that happens, and I will act accordingly. And red is, I understand that I am doing a very full of risk activity, and I am prepared to be arrested if that's what happens. What are your risks for being arrested, and what are your partners? Are one of you undocumented? Does one of you have outstanding warrants or a record? Are one of you responsible for young children and no one else can take over that? And if you go to jail, they have no one to pick them up from school. Are you immunocompromised? Are you just in another position that I'm not thinking of that makes you being arrested a really bad idea at that time? Remember, you should always be going for the arrestability level of your partner. If one person says they're red and one person says they're green, you're going to partner up. That partnership should be at a green level. If you are that far apart in your arrestability, perhaps you might want to think about picking another buddy. Roles. Now, if both of you guys are scanning Twitter feeds, for example, to look out for what's going on next or where the next action is going to be, no one's watching the crowd or paying attention to what the march is doing, it's probably not a good buddy system. You need to decide what you're going to be responsible for when you are out in the streets and what your buddy is going to be responsible for. I like L as for loose ends. It's just like a kind of general catch-all. Is there anything you think is important that you need to share with your buddy that we haven't talked about or isn't in this mnemonic? Share it now. This also is a really good time to exchange emergency contact information if that's what you want to do. And then the why is yes or no. Are we doing this thing? Are we going out as buddies together in the streets? Or are we not a really great match and we should go find somebody else? Both are okay. This is a no-fault divorce. But you want to make sure that both of you agree that, yep, we're going out together into the streets. And so Parole was developed by Earthworm of Atlanta Cop Watch. Sasha from the Boston Street Medics added the why. So we want to make sure we're giving all the credit in the world. Now, when I talk about roles and being aware, I'm talking about situational awareness. I'm going to describe the image. There's a photographer with his camera pointed out towards the sea, and a beautiful, very adorable penguin is sitting right behind him. And he is not situationally aware of what's going around. Otherwise, they would turn around and take a picture of that adorable penguin. So this means knowing what's going on around you. When you get to a protest, look around. As the protest goes on and the situation changes, you want to stay aware. Being aware is one of the best ways that you can keep you and your buddy and your comrades safe. So, are there places to rest or warm up? Are there places to get water, to escape violence, places to pee? Frequently during a protest, there are sanctuary spaces set up, sometimes nearby churches that have opened their doors. So try and be aware of those so you know where you can go to get your kind of basic physical needs met. What are your escape routes out of here? When you're tired or the situation is, as some of us medics call it, spicy, you're not going to be paying attention to what's going on around you. And you want to map out where you're going and how you're going to get out of here if you need to ahead of time. What's the mood of the crowd? Are they calm? Are they excitable? Are there counter protesters coming and that are riling people up? Being aware of the mood can help you avoid risky situations before they happen. Where are the cops and what are they doing? Do they have weapons that you can see? You need to be aware of that, again, to minimize the risk you want to expose yourself to. And are there other shitheads around? And what are they doing? Being aware of counter protesters is critical, especially in the coming months, to make sure you're keeping yourself safe. So just being aware of what's going on and making decisions about what to do can protect you emotionally and physically. It can also keep you out of bad situations you don't want to be in. If you see things coming early, you have the chance to make a decision rather than just react. And yes, JJ, please do go the next time. So this is the biggest thing that us medics are stressing out about right now is how do we keep y'all safe, both from all the regular risks, but also COVID-19. So we want to kind of go over a lot of the same common sense stuff that you've been hearing from Dr. Fauci day in and day out, and also hit anything else that might be unique to a protest situation. So bring your own hand sanitizer and use it after touching anything. A lot of medics and care bearers will have hand sanitizer, and if you just stick your hands out, I'm sure someone will squirt some on so you can rub it, but it's best if you bring your own. wear a face covering and bring a backup. There are lots of ways a mask can be contaminated in the streets, whether it's food or chemical weapons, or it falls off your face and then it's something you don't want to put back on your face again. So have an extra. And I'm sure y'all know this, but I'm going to say it aloud. The mask needs to cover your nose and your mouth all of the time. Even if you aren't afraid of getting sick, your mask protects the people around you, not you personally. Speaking of, don't wear a mask with a vent. The vent means that you personally protected, but it spews germs out onto everybody else around you. If you have a vented mask or a vented N95 that you want to share, that you want to use, please cover it up with a surgical, with another mask, either the surgical loop mask or a cloth mask. So your mask protects both you and others. Remember that chanting, yelling, speaking loudly, all of those things that are so fun to do at a protest also increase your risk of COVID-19. Because you produce more droplets the louder and more forcefully you're speaking. So if you're in a crowd where there's some chanting going on, think about if you can get even more physical distance, and of course always wearing a mask. That includes when you're talking in a megaphone, because I've definitely seen a lot of people shouting into a megaphone and they immediately pull their mask off. So I would love it if everyone kept their mask on. Like I mentioned, stay as physically distant from other folks as possible at a minimum of 6 feet. We're not sure if 6 feet is the right amount, but that's the only guidance we have. So let's stick with that as a standard. Again, even if you might feel comfortable being around other people, they might not feel comfortable around you, and it goes back to radical consent. Respect the space of the others around you. And we know that realistically, at a crowded protest, this may not be feasible, but try your best. If you're going to eat or drink at a protest, stand as far away from the main crowd as possible. Give yourself that nice little bubble that you can feel comfortable taking off your mask and doing what you got to do. And then plan ahead for your safety in a pandemic. Is transportation going to be running? Is the same amount of transportation going to be running that always used to run? Public restrooms are going to be less available as things are closed. Consider alternative places or stake out a couple of places you know are open. And then, like we talked about, consider your risk before you get out in the streets. Who do you live with? Someone elderly? Someone immunocompromised? If you're arrested, they're not doing anything with isolation or social distancing. So you would have to isolate for 2 weeks. How will you make sure the others that are in your social circle are safe in the time it takes to make sure you didn't get it yourself? If you can't be out in the streets, first off, if you're feeling sick, stay home. I promise the protest will go off without you. We will miss you, but it'll be okay. Stay home if you feel sick. And there's lots and lots of ways you can support if you can't attend in person. You can cook food for a friend if they've gone out in the streets. You can donate to a bail fund, a street medic collective, your local NLG. You can watch sources you trust and pass on that information to your friends so they rely on vetted information and not rumor. You can offer to be transportation for your friends to and from protests. You can sew masks and send them with a friend to distribute to an event. Check in with your friends afterwards, see how they're doing. Be the emergency contact, provide childcare. There's so many ways that you can support. And think about what are your specific skills and how can you support your community with those specific skills. Next slide, please, JJ. So you think you've been exposed. You were at a protest. They were packed in like sardines. You're worried. So where can you go get tested? If you live in DC, every single day there's free testing somewhere. You can go to the needatest.com, which I think JJ can put a link in the chat. that will give you the locations every day in DC. Most states have something similar if you're from outside of DC. I know Maryland does. When should you get tested? Hard to say. We're hearing recommendations somewhere around day 3 to day 5 after an exposure. And it's only because you need time if you've been exposed and then caught COVID-19, you need time for your viral load to build up before the swab will be positive. So you don't want a false negative by going in the day after. How long does it take to get results? Well, in DC, they're running on average about 3 to 4 days. So a frustratingly long a period of time. I will suspect that as we get into the winter months, that length of time is only going to increase. So don't be surprised. How good are the tests? Somewhere around 70% accurate, give or take, depending on the test used. But that is all really dependent on how good was the swab. So some swabs need just a quick swipe in the nose, some need a true brain biopsy, and some are in between. So you need to take every test that gets taken with a grain of salt. And what that rolls into, a negative test does not mean you don't have COVID-19. So if you think you had a high risk exposure, which means you were near someone without a mask, in close proximity, in DC when COVID is still relatively endemic, I would strongly consider isolating, and definitely still wearing a mask everywhere you go. Next slide, JJ. Yep. It's going to be. I'm guessing most of y'all have got on this because you want to do something exciting in November. It can get relatively cold in DC in November. So we're going to talk about frostbite and hypothermia. You can lose a lot of heat when it's cold much faster than your body can produce it. So there are 3 steps to trying to watch out for frostbite and hypothermia. 1 is avoid it, the 2nd is spot it, and the 3rd is treat it. Avoiding it. So if it's really, really cold, if possible, stay indoors. We know that lots of folks are going to be out in the streets. So if you're going to go outside, dress properly, and recognize who around you is at high risk for hypothermia and frostbite. So folks who are at high risk, older adults. So if you're in the older age group, make sure you're wearing that extra layer and have a buddy who's watching out for you. People who stay outdoors for long periods, including protesters. People who have been drinking or have taken any drugs. A lot of drugs and alcohol cause vasodilation, which makes you lose a lot more heat. And also, if you're intoxicated, your sensation of the cold can be changed or different, and you might not notice that you're getting cold. We are going to trust that everyone is grown adults and they can decide what they want to indulge in. But we'd recommend, like Bianca said, don't stay sober at least the day before the protests come out. When you're going outside, wear a hat, a mask that covers your face and mouth, a water-resistant coat, mittens or gloves. I personally like mittens because all your fingers stay together and keep each other warm. And several layers of loose-fitting clothing so they can be taken off if they get wet, and water-resistant boots. This kind of getup will be the absolute warmest for you if it's getting really cold. When you're going outside, make sure the parts of your body that are the most sensitive to cold are going to be covered. So that's your nose, your ears, your toes, cheeks, chin, and fingers. And yeah, let's go to the next slide.
If I can add one thing there, especially in DC, we see a lot of humidity that can sometimes come with the cold. So be prepared for the feeling that you might like be all bundled up and be nice and warm and then start to sweat. That's the other reason that layers can be really helpful. So it lets you adjust to let some of that sweat evaporate, and then you can bundle back up, because it can really do a number on your body trying to figure out whether you're hot or cold when that moisture in the air is condensing on your skin.
Okay, we weren't able to avoid it, so now we're going to spot frostbite or hypothermia. So frostbite. Oftentimes, if you have frostbite, you're unaware of the damage being done to your skin because your skin has become numb to any pain. It's literally frozen tissue on your body. So how are you going to know it's there or be watching out for it? Redness or pain in any skin area might be the first sign of frostbite. This is the time you want to treat yourself before it gets worse. If frostbite is persisting, other signs are going to include a white or a grayish yellow skin area, or skin that feels unusually firm or waxy, or numbness in parts of the body. At this point, as a street medic, I might be talking to you very seriously about whether you feel comfortable going to an emergency department, because we're getting close to the time where you're going to need serious medical help. Hypothermia, on the other hand, it often occurs at very cold temperatures, but like Bianca said, if it's cool temperatures but you're also wet, you can also become hypothermic. And wet can be from rain, sweat, or hoses. Hypothermia is entirely possible in a protest situation and can be really dangerous, so watch out for you and your comrades. Signs include shivering, exhaustion, confusion, fumbling hands, memory loss, slurred speech, or drowsiness. We like to call this the umbles. They're fumbling, mumbling, stumbling, because they're just so cold and their body temperature has gotten so low. If you have a way to figure out a person's temperature out in the streets and it's below 95 degrees, get them at least to see a medic immediately. And we can talk to them about whether or not they need to go to the emergency department. Or if they feel comfortable, they might just want to go straight to EMS. So, treat. If a person's experiencing hypothermia or frostbite, in a protest environment, the most useful thing for someone who's who's having very mild hypothermia is to get someone a blanket or extra layers and then send them home. Once you've gotten that cold, it's probably best if you go somewhere and warm up for quite some time and think about coming out if you're going to come out at all that day, or maybe just recovering and coming out tomorrow. If someone was shivering and stopped shivering, and you haven't done anything to warm them up, it's still just as cold as it was, I'd be very worried about that person. So get them help. And don't try and tough it out once you've got the shivers. Your choices are either go warm up or get colder and move into hypothermia. You want to seek medical attention as soon as possible. Get them to a warm room or a shelter, warm them up under dry layers of blankets and clothing, and place any areas affected by frostbite in warm to touch water, and get any wet clothing off them that you can. If you think that you're going to be in a situation where you're going to warm them up and then they're going to immediately get cold again before they can stay warm for a long period of time, it's probably better just to get them immediately to the place where they can be safe and warm. The cycle of like warming and like thawing and refreezing and thawing and refreezing can be quite dangerous too. So get them somewhere warm and keep them somewhere warm. And at this, I will make a conscious effort to pause and say, are there any questions? And anyone, again, can be free to unmute themselves and speak up if they want to.
There were no questions in the chat, but someone made the comment, one extra tip on masks, there are mask brackets that you can buy, which are these little silicone structures. And they really help to make masks feel less claustrophobic because they don't collapse onto your mouth and nose. And it makes it easier to speak normally and keep your mask on while speaking. And then someone else added, just make sure that the mask is big enough to still make a good seal.
Awesome. All right, JJ, next slide. So, like we mentioned before, the number one weapon of the police is fear. So let's take a moment to talk about how to be less afraid in a protest situation. So the first thing is partially what you're doing tonight. Be prepared. So that includes situational awareness and planning ahead and thinking about what you might encounter out in the streets. When you're out there and things get scary, get grounded and get calm. Here are a couple of methods. You can take a couple long, deep breaths. You can do 5, 4, 3, 2, 1. So you want to name 5 things you see, 4 things you hear, 3 things you smell, 2 things you touch, and 1 thing that you can feel in your body. Focus on the sensations in your body. Take a moment to identify all the things you can feel. Can you feel your glasses on your nose, your heartbeat? Can you feel your toes in your shoes? Being aware of your body can help ground you too. You can try listing everything you can think of in a certain category in your head. Every country, every Pokemon, every brand of breakfast cereal, whatever you can think of to try and ground yourself. Try to remember a fond memory. You want to mentally create it in as much detail as possible in your head. If you're really struggling to get yourself grounded, consider temporarily moving yourself from the stressor or the stressful situation and find somewhere that feels safer as needed. So now we're going to take a minute before we move on to get grounded now with 3 big deep breaths. So we're going to go in through the nose and out through the mouth. 2 more, in and out. Last one. And out. Awesome. And on that very calm note, I will pass it over to Bianca.
So there are a lot of tactics that the police can use to get you uncomfortable, nervous, afraid. But one of the ones that probably looms large in a lot of people's minds is the use of chemical weapons. So that's things like tear gas and pepper spray are some of the most common. They tend to sting, make your eyes water, be like they hang around for a minimum of 20 minutes, and they're just generally really unpleasant. And in some cases there is some research coming out that suggests that that tear gas especially can be harmful to people who are pregnant, and possibly causing miscarriages, as well as changing up your cycle for anyone that menstruates. So they're certainly not harmless. They are chemical emphasis on the weapons part. However, the most important thing if you do encounter a chemical weapon is again that we're trying to stay grounded and stay calm, just like what Katie talked about on the last slide. It's easier said than done because this is probably an experience you haven't had before, and you may be in some pain because they do sting a lot. But the more you can regulate your own nervous system, the better able you are to be a calming presence to others and keep everyone around you safe. Um, if you have the presence of mind to do so, and in particularly if you know how to perform an eye wash, or are able to get people to an area away from a chemical weapon, you can very calmly say, please walk towards me if you can hear the sound of my voice. So that's something that anyone can do to sort of move people away from where the clouds of chemical weapons are to an area that feels a little bit more safe. Um, you you will see medics doing eye washes as one of the most common forms of care for people who've been affected by chemical weapons. And the instructions for those, or sort of the general idea, is listed in this middle section of the slide. It's a lot of text. You don't have to read it all, but I'm gonna go through the steps in a minute. Um, but before we talk about eyes, we should talk about lungs, because chemical weapons, when we breathe them in, can definitely affect our respiratory system. Um, Especially the fact that we are in a pandemic, it's very dangerous because chemical weapons can make people cough. This is especially why masks are important right now, and that we are trying to keep people at safe distances from each other, because when you cough, you spread that virus even farther, than when you're talking. If you're a person with asthma, or any other kind of sort of reactive airway situation, chemical weapons can exacerbate that. So you may need your inhaler as a way to sort of calm your respiratory system down. Um, but you should not administer an inhaler for someone else. You can help them find it in their bag if they ask for help, but just give it to the person that needs it. Um, Okay, so for eye washes, there are some myths, rumors out there. There's a lot of different advice you'll see about what kind of materials you should put in people's eyes. And I can tell you the answer is the simplest one is the best one. Just plain water, please. So sometimes you'll hear people talk about milk, and I want you to think for just a second about if you're at a protest in the middle of July and you've been out for an hour and a half and you've been carrying your jug of milk with you. Is that really what you want going in someone's eye? Because it's probably going to be really gross and curdled. Likewise, you do not necessarily want baking soda or any kind of like alkaline liquid um, to wash in people's eyes. They may not fully dissolve the particles. They can sort of scratch at things. Plain water is going to be the most effective, safe, and accessible option for you. I saw a question in the chat about what kind of water you should use, and I don't know if Katie or JJ you want to weigh in on this. I carry regular tap water, although I'm sure that there's certainly nothing wrong with with distilled water.
Uh, do you shower most days and get water in your eyes then? It's all good. It's all good, as long as it comes from a reputable source. So don't do puddle water, but if you get it from the
Oh.
tap, that should be fine.
The only thing I would add is that if you are using tap water and you fill up your eye wash bottle and then you go out, and then you come home and you haven't used it and you go out a week later, you should not keep using the same water. Take the time, refill it with new water, because not very happy things can grow on that, and you don't want those in your mucous membranes.
Yeah, that's very gross. So definitely replace your water regardless of what kind it is on the regular. Thank you for that. So if you want to do an eye wash on yourself, or you want to help someone else with an eye wash, there are a couple of things that you should keep in mind. One, you should be wearing some gloves, because one, we're using sort of standard precautions that we're trying to avoid contact with other people's bodily fluids. But also, everyone has just been sprayed with an irritant. It's not just in their eyes, but on their skin, on their hands, all over on their clothes. So anything you touch, if you have that on your hands and then you touch your own face, you're essentially reintroducing that irritant to your own body. Ideally, you can then switch gloves, or take them off after you've given someone an eye wash, so that your hands are still clean. If the person that you're trying to assist, or if you're trying to take care of yourself, wears contact lenses, ideally they don't wear them to the protest because of exactly this problem. The last thing you really want to be doing is fishing around in your eye while you've got while you're it's burning from tear gas or pepper spray. But if they did wear contacts, they need to take them out themselves before you flush their eyes. Ideally, then they should wash their hands, take the contacts out, then you put the eye wash in. Administering an eye wash is easier for everyone if the person is on their hands or on their knees, so that they can sort of tilt their head to the side away from you and not fall over. Um, because the idea is that you are going to place your squeezy water bottle right at the inner fold of the eye, so the area closest to the nose, and spray down and away so that it's going to fall off the side of the face. So that if you're kneeling and you have your head tilted to the side, that makes it less likely that that water is just going to run down onto their clothes. So um, starting at the inside of the eye and washing outwards with the head tilted to the side. You may need to assist in opening the eye a little bit, because chemical weapons can make people squeeze their eyes tight, close really tightly, because of the burning, and we're trying to keep that irritant out. So you can either ask the person to do that for themselves, or you can offer to do it for them. It sometimes will take more than one squeeze of your water bottle to really get a good flush of the eye. And it probably will continue to burn a little bit afterwards, but you're just trying to get an initial flush to get some of the level of irritant off of them, and it just makes it a little easier for them to recover moving forward. Anything that Katie or JJ wants to add about eye washes specifically? Beautiful. Um, in terms of if you encounter tear gas or pepper spray, once you come home from a protest, you do not really want to bring those chemicals into your house. One, they can get all over all of your other stuff, and two, they can be really dangerous to pets, loved ones, and other anyone living, any living thing in the house. So you want to take everything off, ideally before you come in, put it in a big plastic bag. Then you throw it right away into the washing machine. You want to wash that through twice with warm to hot water, because that's going to one wash to get the chemicals off, and another wash, honestly, to kind of clean your washing machine so that you don't have residue that gets on your next load of laundry. To clean yourself, you want to take a cool shower. And the reason for that is we have lots and lots of pores on our skin, right? And warm water opens those pores up. And if you haven't washed all of the chemical irritant off of you, that just seeps right into the pores. It's going to start burning again. So cool water keeps those pores closed tight and makes it easier for you to wash it off of your skin, and not irritate yourself again. And then we're going to talk a lot more about emotional support, but being chemically sprayed can be a very stressful experience, and you may need to take some time to process that, whatever way makes sense to you afterwards, whether that's talking with a friend, journaling, meditating, whatever helps you get centered after a difficult experience. And you can flip to the next slide.
The only thing I wanted to add about showering after you get home is consider tilting your head either into your shower or over a sink and washing all your hair first. Hair holds a lot of spray in it. And the last thing you want to do is have all that lovely spray run down your whole body, recolonize yourself again with chemical weapon. Especially your genitals. That would not be very fun. So do a good hair wash with your head tilted over first.
Great point. So this slide is super, super text heavy. It's from a zine. So, and we covered a lot of this material in the last slide. But I just want to point out a couple of key things that we should consider. So I talked at the beginning about how avoiding oil-based sprays like bugs, if it's like bug spray or sunscreen. The reason for that is because oil products can trap chemical weapons. So then that burning sensation just stays and stays and stays, because it is much harder to wipe off of your skin when the oil has binded it in. So try to find water-based or non-oil-based things if you must put something on your skin at all. Other things worth talking about. We've already said how pregnancy can be a risk for folks, as well as people with asthma. We also want to be extra careful with any older folks, children, people with multiple illnesses, because chemical weapons obviously put a strain on your body. And so, if for folks that may already have weakened immune systems or are doing a lot of growing, that can be extra hard on their bodies. There are a lot of ingredients in chemical weapons, so folks who have allergies may also experience a stronger reaction. Again, if you've ever been prescribed an EpiPen, I highly recommend bringing it to any action that you think may have the potential for chemical weapons. Um,
Someone asks, will chemical weapons stick to product? Should I wash out anything like leave-in conditioner in my hair prior to going out?
do either of you want to take that?
I, it's a great question that I mean, no study's been actually done on that. I think we have a general sense of like the oil-based stuff. I think probably my best answer to you is the less stuff you have on your body, whether that's makeup, product in your hair, is just one less vehicle for chemical weapons to stick to. So probably going with a product free kind of day or a product minimal kind of day is the best. But that is purely my gut feeling and not based on any science.
That's exactly what I would say is better safe than sorry. I'd rather have unmoisturized skin than a very bad time when sprayed with an RCA.
Someone else asks, if someone is wearing contacts, what's the best way to quickly remove chemicals from the hands in order to remove the lenses, especially if soap and water aren't accessible? Which is fair, because I don't know a lot of medics that carry soap, even if they do carry quite a bit of water for eye washes and hand washes. And honestly, the best answer is obviously not to wear contacts, but I think Katie has something to say on that.
So they do make a wipe that called Sudicon, which you can buy on Amazon. They are not cheap, but they do exist. And I think that would, if I had to say what is the absolute most effective way, those wipes would be it. Otherwise, probably a really good flushing of your hands with water and getting a clean rag from somewhere, or someone's t-shirt, someone's extra mask, and wiping your hands down is probably your next bet. But honestly, if you're doing an eye flush, you already have chemical weapons in your eyes, and you're probably not depositing that much more from your hands, truthfully. And you're definitely gonna throw those contacts out. Like, those contacts are done, so don't worry about trying to like keep them clean and save them. They're toast.
And one other option you might consider, that are slightly cheaper than Sudicon wipes, thank you for that link, is obstetrical towelettes. So those are the things that we give generally to folks in GYN settings to wipe off their labia and their vagina before we do a urine catch. They don't have much on them besides water, so they're a quick way to just wipe off and are disposable. So that's an option as well.
Huh. I wonder if a wet nap would work the same. Like, what you get before you eat crab legs. Anyway, we'll have to do a blinded study on that. Who wants to volunteer to get their hands sprayed with pepper spray?
And then try and remove their contacts. Yeah. I feel like there's some ethical problems with a study like that. Other protester good supplies to have if you're expecting potential chemical weapons. Silicone lined swim goggles are great. They are designed to keep everything out because they don't want water leaking in while you're swimming. They also will generally not let gas in. So if they're fitted well for swimming, they will fit well for chemical weapons situations. You will see big fancy people with respirators for their mouth and nose, but as you might notice, they look a little intimidating, and they can actually be considered sort of an escalation by some law enforcement and be seen as scary by fellow protesters. So while I'd say if you have one, great, you can totally bring it with you, but sometimes the best option is literally just a bandana that you wet down and put over top of your mask. It's a little extra shield against gas coming in, and then you can just ditch it after a chemical attack. Then where I honestly
Bianca.
recommend cheap protest clothes, because again, if they get sprayed and something happens to them, you just need to ditch them, or you've washed them a whole bunch of times and they're starting to deteriorate. No harm, no foul. Don't wear your favorite t-shirt to a protest.
Bianca, can I say one more thing about respirators?
Please.
Just remember that depending on the respirator you have, most are to prevent particles from getting in and not particles from getting out. So in COVID times, a respirator does not protect the folks around you from your COVID germs. So that is definitely another thing to take into consideration when you're deciding what you want to wear, if you want to keep the folks around you safe as well. That's all.
Yes, absolutely. I mentioned that there are a lot of sort of urban myths and things like that out there about encountering chemical weapons. If you have heard of any, feel free to drop them in the chat and we can address whether they have any facts to them. I love this random number 5 up in the top right-hand corner that's talking about putting ketchup and mustard where, I don't know. Or burning tires, not clear what that would do. So I'm curious what other weird advice you've seen floating around the internet. And we can go to the next slide. And we have pretty much talked about all of this, but these handouts will also be available in our Google Drive so that you can look at them in more detail.
All right, guys. So let's talk a little bit about self-care and emotional first aid. So being at a protest can involve seeing or experiencing things that are potentially really traumatic. The first few minutes, hours, and days after potential trauma are important for preventing longer lasting effects. Here are some things you can do to take care of yourself and those around you. So first, when the protest is over, get somewhere safe and calm. You want to reestablish that sense of safety and security in your life where you're in control of things. You want to take care of your body. Get warm. If you need medical treatment, get it. Consider documenting any of the medical treatment you got in case you need that for the future. Have a good meal. Rehydrate. I would again recommend probably staying sober at this point. It's probably not the best time to indulge. And do those things that, again, make you feel safe. Taking care of your body makes you feel safe. You reestablish those community connections. Humans do better when we feel listened to, supported, and connected. So you should give yourself the time and the space to talk about what happened or not talk about what happened, whichever feels better for you. You want to check in on each other, and including your fellow protesters, people you knew were out in the streets. And if you weren't out in the street, check in on other folks. You want to spread calm and care throughout your community. Allow yourself to feel your feelings, whatever they are. All feelings after a protest are valid and need to be worked through and recognized. Don't be surprised if past experiences with trauma get triggered. You want to be patient and understanding with yourself if your reactions feel out of proportion to the event. Your feelings might be a lot bigger than you expected. I personally have experienced this, and I'm sure lots of folks in this room have as well. Minor things seem huge, but also they might be smaller than you expect. You might sail through your protest feeling exhilarated and wonderful, and that's okay too. You're allowed to feel whatever feelings you're feeling, regardless of what they are. And then get some rest. Don't take up new responsibilities right now. and ease up on your current obligations if you can. Enlist other people in your social sphere to help you take care of stuff the next day or two, whether that's food, childcare, transportation, work responsibilities. A protest can be really challenging, and we want you to be gentle with yourself. Next slide, please. Oh, sorry, there we go. Okay, so you want to help a comrade process a potential trauma. Here's things you should do. Check in with yourself first. Make sure that you have the emotional and mental energy to be supportive and present. It's very hard to offer support if you're drawing from an empty well already. You want to stay calm and centered while giving your support. The person that you're talking to might have very strong feelings that may seem directed at you even, but remember, they're not angry, upset, hurt at you. They're frustrated or scared or feeling impacted by the situation. You want to validate your comrades' experiences and feelings, even if you're having a hard time understanding them yourself. Be sensitive to what kind of help they want. And I'm sure lots of people who have partners or who have had partners in the past have experienced this. Your partner wants to just tell you the problem and be heard, and you're looking to give a solution, and that they don't want. So ask and make it really clear, what do you need from me today? What can I offer you? Respect your comrades' privacy. Their emotional unpacking is no one's business but yours and theirs. So respect Vegas rules, and what happens here stays here. And be aware of some of the symptoms of emotional trauma that might be out of scope of what you can help with. Insomnia, nightmares, hypervigilance, flashbacks, a dependence on alcohol or drugs. If it's possible, these are issues that probably should be escalated to a professional, one that's sensitive in dealing with traumatic experiences. We'd suggest that you don't criticize a person's actions or feelings. There's no shaming here. Our feelings are our own. And oftentimes we're acting in really stressful situations where we don't have a lot of time to think through everything. You don't want to pressure the person to tell you their story. If they want to, fine, but it's not your story to hear or tell if they don't want. Don't interrupt or rush. Take your time. Listen with an open ear and an open heart, and let the story come out in its own time. Don't tell them how they should or shouldn't be feeling. I suspect we've all had that happen to us, and it does not help if someone says don't be sad or mad or scared. Don't tell them someone else's story. Right now, they don't want to hear it. There may be a time in the future where that will be helpful. Right now, it is not. And only offer it up if you have permission from both the person experiencing the trauma and the person whose story you're telling. And don't give false promises or reassurances. Right now, you can't promise that everything's going to be okay or that they will recover from this. Just be there and listen and offer the support you can. And with that, our program is complete. JJ, if you want to go to the last slide, we want to say thank you for coming. We want you to stay safe out there. If you've got questions or you want to help, we have an email. It's medics@shutdowndc.org. And then what I am going to do is I'm going to stop recording now. So if anyone wants to unmute, and we'll stop sharing. If anyone wants to unmute and ask those questions in their real voices, we will take them now.